I'm very excited to welcome our next presenter, Dr. Nicole Kiss, who will be presenting on using diet as medicine. Associate Professor Nicole Kiss is an advanced practicing dietitian with more than 20 years experience in cancer nutrition, including clinical research and allied health service management positions. She is a clinical associate professor and Victorian Cancer Agency Clinical Research Fellow in the Institute for Physical Activity and Nutrition at Deakin University, and also co-leads the Exercise and Nutrition for Cancer Research Group. Nicole's research interests include interventions to optimize nutritional and functional outcomes during and after cancer therapy, with a particular focus on body composition. So thank you again for joining us, Nicole, and over to you.
Thanks, Laura, and thank you very much for inviting me to speak today. It's a real pleasure to be able to join you, especially for Myeloma Awareness Month as well. So what I've been asked to present to you today about is using diet as medicine. So what I wanted to touch on first is the different focuses we have for nutrition depending on which stage you are at in your cancer journey. So there's a very different focus for nutrition when you're going through treatment, and particularly in that immediate recovery period following treatment, as opposed to what you might do longer term for your health. So during treatment and recovery, our main focus is really on preventing the development of malnutrition and muscle loss, while managing symptoms that are affecting your food intake to really help you optimize what you're able to eat. Whereas when we're looking more in the longer term health, what we're aiming to do then is like we do for anyone in the population, is really about aiming for healthy weight and reducing your risk of chronic disease. So what I'm going to focus on today in the presentation is during treatment and recovery, and we're really going to talk a bit about malnutrition and muscle loss, what they are, how you can recognise if you have them, what you can do about it, and also how to manage some of the symptoms you have that might be affecting your ability to eat enough nutrition. So before we go much further, I wanted to just tell you a little bit more about what I'm actually referring to when I say malnutrition or muscle loss or low muscle mass. So when we're talking about malnutrition, this means particularly an unintentional loss of weight, loss of muscle, and also loss of subcutaneous body fat that can occur alongside a reduced food intake. And while loss of muscle is a component or a part of malnutrition, low muscle mass itself is when you have an overall body muscle mass that's lower than average for your age and sex. So what actually causes malnutrition and low muscle mass? And these are multifactorial things that can occur while you're going through cancer treatment. So one of the main things that can contribute to it is that during the treatment, because of the stresses on your body from going through the cancer treatment, you actually need more energy and protein than you normally would. So even if you're eating your normal amount at the moment, it may not be enough for you and may lead to unintentional weight loss or muscle loss. Also, symptoms that are affecting your food intake. So most of you will be well aware that the cancer treatments can come with a wide range of symptoms such as nausea and vomiting and loss of appetite that can really make it very challenging to be able to eat what you would normally be eating. Metabolic changes as well can occur where perhaps the nutrients that you're eating are not utilised quite as efficiently by your body as they normally would be. And the other component can be physical inactivity, and it might not necessarily affect everybody, but the fatigue that can come along with treatment, as well as the numerous appointments and everything else that you're dealing with, can really make it difficult to maintain any physical activity. So does this matter? Does it matter if you have malnutrition or develop malnutrition or low muscle mass? And what I wanted to just talk through with you is that there are some factors that can definitely lead to poorer outcomes, but we will then talk about how you can reduce this and improve your nutritional status and muscle mass as well. So having malnutrition or low muscle mass can lead to more severe treatment side effects. It can also lead to a poorer quality of life, make it harder to get through treatment. It can also lead to a weaker immune system, and obviously that's something that's extremely important while you're going through your treatment. It can lead to a longer time for wounds to heal, which can be particularly important after going through any surgery. And it can lead to a longer time spent in hospital just because of the time taken to recover, and can also be associated with poorer survival. So it is obviously extremely important that we recognise malnutrition and muscle loss early, and we intervene to minimise the impact that it can have. One of the things that's really important, and I really want to point out to you as well, and I think is not even necessarily very well recognised by all health professionals as well, still, but you don't need to be visibly underweight to be malnourished. So there can be this perception that malnutrition is someone who is extremely underweight. Malnutrition can actually be present in anyone of any body shape or size. And the graph that you can see here on the screen is from a large study that we've done here in Victoria across most Victorian cancer services, where we looked at the prevalence of malnutrition. And what you can see is, although the highest prevalence is in people who are considered underweight, 1 in every 6 person who was overweight or obese was malnourished as well. So it's really important to understand that it can occur in anybody. And one of the reasons for this is that underlying muscle loss can be occurring or present without you actually losing overall weight. So that's something that is important to understand. And that muscle loss can often be hidden, particularly, and can be really quite hard for your health professional to notice. So what are some of the ways that you can recognise malnutrition and muscle loss? So some of the symptoms or signs that you might notice are if you've lost weight without meaning to, so perhaps your clothes or your jewellery feels looser than it normally does. You might be eating a bit less than normal. You might be experiencing a loss of energy or feelings of fatigue. You might have noticed a reduction in the size of your muscles, particularly in the arms and legs. Now, each of these individually may not be a reason, it may not point to malnutrition being present, but it's really important to understand that it could be, and to look at identifying whether you might be at risk of malnutrition, and then getting referred or getting access to some nutritional help to help you deal with this. One of the ways we look at whether you might be at risk of malnutrition is using something called the malnutrition screening tool. And I've got a web link there on the screen as well. This is a freely available tool that you can use through the Peter MacCallum Cancer Centre website. And the malnutrition screening tool they have is a web-based tool there where you can actually look at your risk of malnutrition, and it's available in up to 10 different languages other than English. It really asks you a couple of questions about whether you've experienced any weight loss recently, if you have, how much you've lost, and whether you're having any difficulties with appetite or food intake. And the output of that tool will then tell you whether you could be at risk of malnutrition or not, and give you some suggestions of where you can then go on to find some help. So that's what I wanted to talk more about now as well, is what can you actually do about it? So if you are at risk of malnutrition, or you've been told you have malnutrition or muscle loss, there's a number of different things we can do. So symptom management is one of the big ones, optimising your nutritional intake and being physically as active as possible. And I'm going to go through each of these now in a little bit more detail. So we look at optimising nutritional intake first. So often people will ask, do they need to change what they're eating if they're going through cancer treatment, or if they have a cancer diagnosis? There isn't any particular diet that we recommend for you while you're going through treatment. So typically, if your appetite is not changed, if you're not really experiencing any symptoms that might be affecting your food intake, if you haven't lost any weight without trying, then just focusing on good sources of energy and protein might be all you need to do to try and keep yourself as fit and as well nourished as possible as you're going through treatment. But it is important to remember that your energy and protein needs are likely to be higher while you're going through treatment and in that immediate recovery phase. So when we talk about your energy needs, as I said, your energy needs are a bit higher than they are normally while you're going through treatment and recovery. So if you're aiming to prevent cancer-related malnutrition or muscle loss while you're going through treatment, we recommend aiming for an energy intake of around about 125 kilojoules for each kilogram of, and that should say body weight, sorry, meaning that if you weigh 70 kilograms, that is around about an intake of just under 9,000 kilojoules. But what's really important to remember as well is that this is just an estimate. So you do also need to check if you are losing weight, then what that really means is that you're not actually eating enough to maintain your weight at that time. So it's a sign that you do need a little bit more. So some of the food sources of energy, and I'm sorry, hopefully this is not too basic for some of you, but carbohydrate foods, so bread, pasta, noodles, rice, and other grains, and particularly healthy fats are really good sources of energy. So fats are a more energy-dense source of nutrients than carbohydrates and protein. So it's particularly helpful if you're losing weight, but you're struggling to eat more. It's a way of getting in more energy in a smaller amount. So when we're talking about healthy fats, we're talking about things like full cream dairy foods. We're talking about olive oil, so you can use extra when you're cooking, drizzle more over salads and vegetables to really just add some extra energy to your foods. Avocado, nut butters, seeds, and nuts are also really good healthy fat sources. Sometimes, though, these types of foods can be really hard to eat if you're not feeling particularly well. So if you are really looking to put more energy into your diet, using other things like creams and ice cream and other fat sources that we typically wouldn't say are as healthy, that's really important way of or a strategy to improve your energy intake if you need to as well. So protein needs, again, should be really aiming to prevent becoming malnourished or losing muscle, aiming for somewhere between 1 to 1.5 grams of protein for each kilogram of your body weight. So if we use the similar example of a person who's 70 kilograms, we're looking at somewhere between 70 to 105 grams of protein per day. And I'll show you a resource in a moment where you can work out what sort of protein amount is in various different foods. So what's really important is to try and include a source of protein at each of your meals and snacks if you can. And protein, again, hopefully not too basic for some of you, but meat, poultry, seafood, eggs, dairy foods, soy-based products, legumes, nut butters, and nuts and seeds are all sources of protein. So if you're losing weight or you've got signs of muscle loss and your appetite is low in particular, prioritising eating those protein sources at your meals and snacks is really important to help prevent muscle loss in particular. And the link I've provided there on the screen will provide you with an information sheet that does actually have various sources of foods and how much protein they contain if you would like to really look at your own protein intake. So we're going to move on then to the next thing, which is managing symptoms. And so obviously optimising your nutritional intake is extremely important in preventing malnutrition or preventing muscle loss. But that can be really hard if you're experiencing symptoms that are affecting your ability to eat. So that's the other aspect of really trying to support your nutritional status and nutritional health. So if we look at nausea and vomiting, first of all, so this is a symptom that's commonly associated with a number of different chemotherapy drugs. And besides treatment, there are a number of other risk factors that put you at slightly higher risk of experiencing nausea in particular. So being female, being a younger age, if you are or have been susceptible to motion sickness normally, if you have psychosocial issues such as anxiety, or if you have had previous chemotherapy treatment and found yourself to experience nausea during those times. And what we've found is that with modern antiemetics, we've really been able to improve the prevalence of people who are being affected by vomiting, with now less than 20% of people being affected by that from their chemotherapy. But nausea is still affecting up to 60% of people who are treated with chemotherapy, and has a really significant impact on ability to eat. So obviously we know that nausea and vomiting can lead to malnutrition, because obviously you might not be keeping down the food and then can't actually benefit from those nutrients. But it can also have an indirect effect on your food intake, where you don't actually want to eat because of the nausea that can be induced by that sort of food. So some of the things that we suggest doing, there's some meal modification strategies that can help. So things like particularly spicy and fatty foods can sometimes make nausea worse. Having flavoured cold or warm drinks and foods can be easier to manage. So drinking cold, clear fluids between meals. You might have heard people talk about ginger ale, in particular, fruit juices, lemonades, and things like that. Make sure that when you're eating that you are choosing foods that you know you've tolerated well previously, particularly things that might have neutral odours if you find that the smell of food is something that really triggers your nausea. Avoiding unpleasant food textures, and often dry foods like toast, crackers and cereals can be really helpful. There's also some behaviour-related strategies that can help as well. So eating slowly, so you're not overloading your stomach. Again, a similar kind of strategy by having small, frequent meals. So perhaps instead of eating 3 meals per day, you might want to eat small meals every couple of hours, or just a very small snack every couple of hours. And it's also really important to avoid skipping meals. So we know that having an empty stomach, can also induce a feeling of nausea as well. So making sure as much as possible you can have small meals frequently to avoid that empty stomach feeling. Avoiding overeating, though, obviously you don't want to become too full either. And then some lifestyle and environment related strategies can be keeping away from the kitchen when meals are being prepared, particularly if you find that the smell of food is something that triggers your nausea or vomiting. Being in a pleasant and a nice environment while you're eating can make that a more enjoyable experience. Avoiding strong odours, things like perfumes and cleaning products, which could also make you feel nauseated, not just the smell of food. And undertaking activities that can help distract you from the nausea as well. And a couple of examples there are exercise or hobbies. The next symptom that I wanted to talk through is mucositis, or also known as having ulcers in your mouth or gut. And this is commonly associated with some chemotherapy agents as well, but particularly with stem cell transplant conditioning regimes that include melphalan. And it can affect up to 85% of people who are treated with a stem cell transplant. And the really important things for management include having good oral hygiene, using topical anaesthetic mouthwashes, and really importantly, analgesic agents. So something that can really control that pain as much as possible will allow you to be more likely to be able to eat. So this has a pretty obvious effect on your nutritional intake as well. So if it's painful to eat, obviously that's going to lead to a reduced food intake. So that's where it's so important to be working with your treating team to make sure that the pain is managed as well as possible. In terms of your diet, then the strategies that we usually suggest are trying to have soft foods, bland foods, and things that are particularly high in energy and protein. So some examples I've put there are things like yogurt and smoothies. Mincing or mashing or pureeing foods like meats and fruits and vegetables can also be really helpful, so that smooth texture is much easier to manage if you've got ulcerated mouth. And foods that are at cold or room temperature also. So hot foods tend to be much harder to manage when you've got ulcers. Things like alcohol and foods that are hot or spicy can also irritate the ulcers. And same with acidic foods such as citrus fruits and drinks, and likewise with hard foods like crackers and nuts. So avoiding those types of things, having as smooth food as possible and things that are relatively bland. Then dysgeusia or taste changes is another very common symptom that can be experienced. And this is quite often seen following a stem cell transplant. And it can affect up to 70% of people who are going through cancer treatment and can be really challenging to deal with. If food doesn't taste the way it used to, it takes a lot of the enjoyment out of it and can make eating a real chore. There is a little bit of confusion about whether what you're experiencing is actually changes to your taste per se, or whether it's changes to other senses like smell and touch, which could actually be affecting the flavour of food as well. And they're two different concepts. So if you are experiencing difficulty or you're finding that things are not tasting the way they used to, it's important to work with a dietitian if you can to really identify which component of that might be affecting you and then get some strategies to help you deal with that as best as possible. What we tend to find is when you're having taste changes as a consequence of chemotherapy treatment, there's a real cyclical effect where the taste changes will develop shortly after the chemotherapy treatment, recover, and then as you have another cycle of chemotherapy, you go through that same process again. Whereas with radiotherapy, it's a much more cumulative effect where you might start with very mild taste changes, and as the course of radiotherapy progresses, they develop more and more. So again, this can have a very big impact on your ability to eat. It can lead to food aversion. So if it's not pleasant to be eating, it's very difficult to continue trying to increase your nutritional intake, and can consequently lead to a reduced appetite as well, all of which can lead to malnutrition. So the types of dietary strategies that we suggest for taste changes are really a lot of it's quite experimental in terms of trying to work out what works for you personally. So if food tastes too sweet or too salty, it's trying no added sugar or salt varieties, for example. Experiment with different seasonings, so things like fresh herbs, garlic, honey or ginger, and working out which of those tastes pleasant to you and which of those doesn't work for you. Some of the behaviour strategies are really about keeping your mouth as clean and fresh as possible, so that can help to get rid of anything that might be contributing to a bad taste in the mouth. Drinking water, that should say meals, sorry, after meals and snacks to wash away any unpleasant tastes, and using a straw. If there's areas of your mouth that you feel are contributing to a poor taste, using a straw to direct food and or drinks, I should say, away from that area of the mouth can really help. Then diarrhea is one of the other symptoms that can very much affect your nutritional intake or certainly lead to malnutrition. And it's commonly associated with a number of drugs that might be used with multiple myeloma. And besides the treatment, some of the other risk factors can be being over 65 years of age, if you have a low BMI, and having other comorbidities or health conditions, things like diabetes, hypertension, or in particular, inflammatory bowel disease. And diarrhea can affect anywhere from 50 to 80% of people who are going through chemotherapy. And its incidence during immunotherapy and targeted therapy treatments can be quite variable. So again, diarrhea has a big impact on food intake and absorption. So there can be direct losses from the gastrointestinal tract, so your body's not actually getting the benefit of those nutrients, but also an indirect effect where, like with nausea and taste changes, it might make you not feel like you want to eat because you don't want to experience the symptom. And each of these can lead to malnutrition. So the dietary strategies that we recommend here is drinking enough fluid in particular to avoid dehydration. So that's extremely important. avoiding foods that are high in insoluble fibres, so things like whole grain breads, nuts and seeds, raw fruits and vegetable skins. So these can irritate your bowel and contribute to diarrhea. Foods that also can increase bowel activity are things that are spicy, fatty or oily foods, and caffeine and alcohol. So they're also best avoided. But foods that are low in insoluble fibre, so things like bananas, mashed potato, white rice and pasta and white bread, those sorts of things can be helpful. And also foods that are high in soluble fibres, so things like oats, peeled fruits and vegetables are good things to try. So the last thing I wanted to talk about then was being physically active. I'm not an exercise physiologist or a physiotherapist, so it's not my area, but I just want to touch on how this can really help in terms of muscle mass and maintaining nutritional status. So being physically active can really help support muscle health. It can reduce risk of muscle loss. Muscle loss is a component of malnutrition, so reducing your risk of muscle loss also reduces your risk of malnutrition. It improves strength, mobility, energy levels, and your ability to do your day-to-day activities. And it can really help manage some of the common symptoms and issues that can be experienced through cancer treatment, like fatigue, anxiety, and depression. And I think most of us probably know that it can also improve your appetite as well. So if that's an issue for you, it can be extremely helpful. And it also avoids that detrimental effect that you can experience from a lot of bed rest and sedentary time, where muscle loss can occur just because you're spending a lot of time resting as well. Couple of last points I wanted to touch on, so some special considerations during stem cell transplant. So what we tend to find is that most people are well nourished at the time of going into hospital for their stem cell transplant, but the impact of the stem cell transplant itself can lead to muscle loss and malnutrition both during and after the admission. So really, what your dietitian is trying to do with you at that time is to minimise any weight and muscle loss that occurs during your admission by really helping you to optimise your nutritional intake, managing your symptoms, looking at tube feeding if possible, and if you're able to, minimising the amount of bed rest that you're having. And then with a real focus on rehabilitation after your admission and recovery time following your discharge. And then finally, just touching on infection and antibiotics. So neutropenia, I'm sure that's a word that's familiar to many of you, and food safety. So really what we recommend is similar recommendations as you would find for during pregnancy. So avoiding foods that are associated with a higher risk of foodborne infections, so particularly listeria. Really making sure that you use foods before the best before dates, and practicing good hygiene with washing hands and raw foods all very well. And there's a link there to some further information as well. And antibiotics, I know a speaker prior to me was talking about gut health. It's not an area that I have a lot of experience in, so I've put another link there for you on the screen as well if you're interested. But really, as much as possible, eating a wide variety of plant-based foods is what can really help optimise your gut health as well. So I think that's all. I hope I've left a bit of time for questions if there are some.
Thank you so much, Nicole. That was a really comprehensive breakdown of a number of strategies that people can use. And I hope that the audience has found it as useful as I have. I think you always learn something new listening to these presentations. A couple of questions. I've got one question which is something that us nurses often get asked and don't quite know how to answer. Do you have any recommendations or, I guess, comments on using protein supplements like protein powders or protein fortified foods? They are, very well marketed at the moment, and when we're trying to encourage patients to consume more protein, often one of the things we hear is that it's challenging for them to logistically and practically, increase their meat intake. Any comments on kind of protein fortified things?
Sure. Yes. So, I mean, typically what we do is try and help people optimize their food intake first. But you're absolutely right. That's not always possible, and it can be really challenging. And these protein supplements are an excellent source of protein, of vitamins, minerals, and extra energy. So absolutely, what we would normally do is work with people, figure out how much they're actually managing to get in terms of energy and protein through their food intake, and then top up with those types of supplements. And there's a wide variety available on the market. You can make homemade versions even with just, powdered milk, for example, to fortify normal plain milk. There's many different options, and yeah, they're a very often easy way of getting in some additional protein and energy.
Yeah, definitely. Got a question here from online. Someone's curious about oral thrush, and does that have any kind of relationship to our nutritional intake? And I guess kind of looking further down the gastrointestinal tract, the gut flora in our bowel as well. Is there anything that we should be doing with our nutrition to optimize that space there?
Sure. And yeah, as I said, gut health is not my area of expertise. So I'm sort of giving you as much as I know. But I guess things like oral thrush, it can obviously occur when your immune system is compromised, which often happens obviously through cancer treatment. And in that situation, it's hard to do a lot to prevent that through diet. So I think you're obviously having an enormous strain on the body by having the cancer diagnosis and treatment itself. So I think don't put more pressure on yourself to feel like you have to be eating a certain way to prevent that. But certainly we know that gut health is improved by plant-based foods in particular. So a really wide variety of plant-based foods optimize gut health. There are other foods. I'm not as, I guess, sure how well these foods would be tolerated, or even how good they might be, I guess, during a course of chemotherapy. But fermented foods in particular are very good with gut health. But obviously there's that element of immune compromised situation as well, where there's a bit of a balance. So I think discussing that with your health professional is extremely important. Probably with oral thrush, though, one of the biggest things is it's very similar to having mouth ulcers or mucositis. It can be really painful to eat. So the advice that I gave previously about mucositis and having smooth and bland types of foods also applies in that situation as well.
Wonderful. All right. Well, thank you so much for your time. It's, as I said earlier, we always learn something, and it's been a really, really comprehensive breakdown of, the things we can do in our own homes to optimize our nutrition, but also the things we should be asking our health professionals for more support in potentially as well.
Sure.
Thank you so
Thanks
much,
for having me.
Nicole.